I'm Tien. I think I'm the first of this group to come to this department, 1986. And actually, I was finishing resident psychiatry at Stony Brook, December. I just purchased a PC, and Bill called me up and said, "Do you have a computer?" I said, "I just bought one." He said, "You're in." Remember that? Yeah. Yeah. And then I was at that point really focused on neurotransmitter circuits. Like, this is the solution to all these problems of mental health and mental illness. And I spent 3 months trying to use a spreadsheet to model frontal lobe dopamine circuitry. And I realized that's not very easy, and I had some more things to learn. So I made the decision to come here versus going to University of Texas, Dallas, or some guy doing frontal lobe brain receptor research in schizophrenia. So I came here, fantastic. This is really my home in the world, is this department, and friends and colleagues, and really the global network. And this is the challenge I had, and it still happens today. Bill told me this last week, so I don't know what you're talking about. So this is a little subset of how my mind works. But in the middle, in 1997, I started my company, MD Logics, Medical Decision Logic. Just to give you some context before that, and to get to this point, there's so many people that just really helped me be who I am. And one of my uncles, my father came from China with his 3 younger brothers in 1949. They went through World War II as teenagers, and you can imagine what that was like. They all came here, and U.S. didn't allow women from China to come in at that point. Very racist immigration policy. So they all married people from other ethnic groups. So we're all kind of biracial, my cousins and my nephews and nieces, and we had lots of mental health problems, actually, interestingly. But my uncle, the third uncle, was a psychiatrist. He finished residency at the University of Michigan in 1960. He then went and got a master's degree in electrical engineering, which I think is probably the only psychiatrist at that point that did that. And he created a practice in Michigan, in East Lansing, in the 60s, using two-way video technology. He could have 25 patients in all the different rooms, would interact with them using video, recorded feedback, incredible stuff. To me, that was psychiatry. And of course, also there were no constraints on getting reimbursed then. He got reimbursed for all his patients at the same time and made a lot of money. He was also a Marxist. So we had great arguments about, what does all this mean? He then dropped all that and spent the next 20 years trying to computerize the Chinese language, and he failed in that. And I began to learn about information technology. So he died about a month ago. We had this, really good memorial. Learned a lot more about him, and just amazing, that we all are so much based in our ancestors, in our family, and everything kind of repeats and goes on, and we try to learn more. So that's been important to me, just to understand that. I started MD Logics, and I had all these projects, all small business innovation research funding, no venture capital guy's going to touch this guy, right? This is crazy. But made a lot of progress. At one point I had 20 projects, mostly NIDA, NIAAA, NIMH, one DOD, and I had 10 engineers in the company at this point. And I said, guys, let's create one platform for all these 20 projects, because we can that way be more productive, more efficient. That'll be a great thing to have that platform. We did that, and because we did that, we got a contract with the School of Medicine in 2005. Ironically, with the Cancer Center. They were the most kind of ready to work with, trying to solve the problem of how do we manage thousands of clinical research studies across the whole enterprise and minimize the chance of adverse events and people even dying from studies. That was deployed in 2008 at Hopkins. Went through all the different gauntlets. Now it's version 15.1. There's 8,000 protocols on this system, a couple 100,000 subjects, and most of you don't know anything about it. It's licensed the entire university, and I'm trying to get your help to help me put this into action in the School of Public Health, and it's just a great tool set, and we're happy to come in and teach people how to use it. But that led to a project in 2008 with one of my friends got funding from HRSA to study how to screen adolescents and adults in the ED for suicide risk and all the 13 domains of risk factors. We used the CRMS as a platform, implemented the questionnaire in a couple hours, then spent 6 months figuring out how the nurses could use it in the ED. Very successful study. When we finished it, a year later, we were going to turn off the servers in Baltimore. Nurses said, no, we want to use this for clinical care. So that was translation in 2008. That was fantastic that they asked for that. That's been expanded. Now we have this system for behavioral health screening and assessment and tracking. 3 states are deploying it: Pennsylvania, Delaware, New York, over the past several years. This year, Medicare, CMS actually allocated $50 million for behavioral health integration in primary care, funded this 5-state consortium, the Animal Alliance, Indiana, Kentucky, Tennessee, Mississippi, Alabama, to use our tool and expand it across these states, which is great, and it's very slow still, but it's happening. New Jersey and Florida are on board, and it's being used in emergency departments, primary care settings, schools, crisis center, mobile crisis teams, and now talking to the work of juvenile justice. So this is just a small start. All those places have lots of barriers and challenges, but it's happening finally. And clearly, I want to talk to you, Paul, more about this, and everyone else here. So what's happened is my original vision for how we could use software and computer technology is actually now happening. It's only taken about 18 years, but. So the last thing I want to say is everyone knows Carl Jung, right, who had the idea of the collective unconscious. So what we have now is what I call the collective semi-consciousness, otherwise known as the web. And let's make it the collective smart consciousness and make better decisions and actions and measure the outcomes.